information.
The importance of data has grown. Criticality of data science has grown. The volume of data has grown. Types of data have grown.
Innovation.
What has really shifted lately because of technologies that have come on board is you diagnose earlier, you treat earlier.
Transformation.
Precision medicine has had an enormous impact. It has begun to transform the whole model.
And reflection.
I often felt like I was a 75-year-old man living in the body of a 55-year-old man and couldn't imagine another 30 years of life living that way.
Discover these and more inside this special 2025 Year in Review edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. We launched our 2025 year of shows by highlighting some of the CTSI's star scholars, researchers who have completed various translational research workforce development educational programs offered by the CTSI. These include the KL2 Mentor Development Program, the Clinical Research Scholars Program, and the Clinical and Translational Science Master's Certificate programs. We heard from Dr. Lubna Chaudhary, Associate Professor, Department of Medicine, Division of Hematology and Oncology.
I've been very fortunate to complete my fellowship here and then being a faculty for almost 10 years now. I've had great mentorship, and early on in my career, being focused on academics, this was a lot of good mentorship, and just wanted to explore these programs to improve the clinical and translational pathway that I was interested in.
Dr. Jennifer Knight is a professor of psychiatry, medicine, and microbiology and immunology, and a member of the Cancer Center at MCW, who shared one of the many formative lessons she learned from the CTSI's educational courses for researchers.
I do very interdisciplinary work, and the skill of being able to converse with people across disciplines, I think, has been the greatest skill. I'm not a basic scientist, and I'm also not a biostatistician, but they're absolutely critical to the work I do, and you need to be able to really understand the different languages, the different environments. So I really think often about that translational piece.
We also heard from Dr. Anita D'Souza, Professor and Associate Chief of Research, Department of Medicine, Division of Hematology and Oncology. Today, Dr. D'Souza is a mentor herself, helping others become better researchers and future mentors.
It kind of comes full circle, right? So the CTSI trained me. Now I train my colleagues and early career faculty from my division. And the goal is they ultimately go on to get external grants and very successful careers, then ultimately become mentors themselves.
The spotlight is on star scholars of the CTSI on our January show, episode number 129. 1 in 10 Americans are diagnosed with diabetes. And while the disease can be dangerous, even deadly, it's also manageable and treatable. In February, we discovered what exactly diabetes is and gained a better understanding of its common characteristics and its comorbidities. we heard from Dr. Srividya Kadambi, Senior Medical Director, Chief, and Professor, Department of Medicine, Division of Endocrinology at Froedtert and the Medical College of Wisconsin.
You know, diabetes is really a major health concern because 1 in 10 Americans have overt or actually full-blown diabetes, and about 96 million Americans have prediabetes, and it's growing. So it's a major public health challenge. But it's not just blood sugars being high, which might predispose people to infection and such. It also portends other complications like vision loss, kidney problems, neuropathy, and then resultant cardiovascular complications such as heart disease or what we call as peripheral vascular disease that may cause ulcers in the foot and amputations. So it is really, really a major risk factor for a number of health conditions and really needs to be addressed at a very early stage.
Then, we learned about specific medical issues patients are prone to experience as a result of their diabetes. Dr. Brian Fisher is a podiatrist and foot and ankle surgeon at Froedtert and the Medical College of Wisconsin. In his practice, Dr. Fisher focuses on diabetic-related neuropathy, or nerve damage caused by diabetes.
That can really present in a lot of different ways. For most people, burning, tingling, electrical shock type signaling that they will feel in their feet. And then there's also the component of loss of sensation that can really present with neuropathy.
And he stressed being proactive can mitigate risk.
Patient education is very important before they even have a problem. So we prevent all of these things from becoming an issue. If they're seeing somebody like a podiatrist consistently, at some point they may develop those symptoms, but we're going to really mitigate the risk associated with those symptoms.
It's the battle to beat diabetes on our February show, episode number 130. We march on to our March show, when we discovered tiny glands in our body that play a huge role toward our overall health. Dr. Tracy Wang is a professor, Department of Surgery, Division of Surgical Oncology at Froedtert and the Medical College of Wisconsin, who shared her expert insights on our parathyroid glands and their primary function.
The parathyroid glands produce a hormone called parathyroid hormone, and this hormone regulates how our bodies hold onto calcium in our blood. When our body's levels of calcium get a little bit lower, it's a signal to our parathyroid glands that we need calcium. So the parathyroid glands will produce a little bit more hormone, and then our bodies absorb calcium from our diet, gets it from our bones, and increases our calcium levels. I often describe this as sort of like a seesaw or a nice balance, and it's constantly in flux in our bodies.
Dr. Wang also told us about a specific condition affecting the parathyroid glands, known as
hyperparathyroidism. There's a few different forms of it, but primary hyperparathyroidism is when our parathyroid glands are not functioning properly and are overproducing parathyroid hormone, which causes our levels of calcium in our blood to be too high.
The combination of calcium and PTH hormone can have serious consequences.
Because it stimulates your bones to release calcium, which can lead to changes in your bone mineral density. It can cause your kidneys to need to filter a lot more calcium running through your blood, which we think can have effects on your kidney health and potentially be a risk factor for developing kidney stones.
We also heard from a patient named Monty, who is diagnosed with hyperparathyroidism.
I often felt like I was a 75-year-old man living in the body of a 55-year-old man. Eventually, I got to a point in my life I was feeling absolutely miserable and couldn't imagine another 30 years of life living that way.
But just months after successful parathyroid gland surgery,
I had the surgery done, and it was like night and day, the best thing that ever happened. I felt at least a decade younger almost immediately after surgery.
Learn about hyperparathyroidism on our March show, episode number 131. Having a kidney stone is a relatively common occurrence, and while they're typically small in size, they can cause disproportionately big pain. In April, we learned all about kidney stones from Dr. Jonathan Ellison, Associate Professor, Department of Urologic Surgery, Division of Pediatric Urology at the Medical College of Wisconsin. and a pediatric urologist at Children's Wisconsin. Dr. Ellison told us they're called kidney stones because, well, they're
actually a stone. Almost all of them are comprised of calcium, and then that calcium typically sticks to some other type of compound that will then crystallize and grow out. And then sometimes stones have different components they're completely comprised of or partially comprised of.
And he doesn't sugarcoat the fact that having a kidney stone is no picnic in the park.
It's often described as the worst pain of one's life. So the pain of passing a stone can be significant and severe and can last for days or even weeks in some patients.
Fortunately, Dr. Ellison leads the Kidney Stone Engagement Corps, or KSEC, whose mission is
to amplify the voices of patients and family members and caregivers for research in kidney stone disease.
Making the KSEC designed with the patient in mind.
The KSEC really works to enhance research for kidney stones by providing a platform for patients to give their opinions and insights into the research development. And we need our patients and their caregivers to provide us insight into how to design those trials most effectively.
Discover Stepping Stones, Advancing Kidney Stone Disease Research, on our April show, episode number 132. In May, the show went on the road to our nation's capital and the Association for Clinical and Translational Sciences TS 2025 National Conference. There, we heard expert insights on a wide variety of topics, ranging from
clinical and translational science,
health disparities,
genomic studies,
inclusion, collaboration and partnership, team science,
patient advocates,
basic science.
First, we heard from Dr. Alan Brazier, President of the Board of Directors for the Association for Clinical and Translational Science, or ACTS, who explained,
by using the word translation, we mean advancing health interventions from the bench to the bedside to sustainable use in the community. The process of translating discoveries into health is inefficient, expensive, and complicated. So ACTS is an organization of translational scientists united to accelerate advances in human health.
Then we explored TS 2025, speaking with people like Dr. Kat Phelps, Community Engagement Research Consultant at the University of Wisconsin School of Nursing, who led a discussion on community leadership.
There's a growing intersection of academic and community voices coming together to making stronger research that has a broader reach and greater relevance, because all the way through the cycle, the community member has been involved in the process. Not at the end when it's all said and done, but all the way through the process.
Dr. Lynette Hammond-Jerido, Assistant Professor, Department of Bioethics in the School of Medicine at Case Western Reserve University, led a discussion prioritizing funding for health equity research.
Communities have something to contribute to those conversations, as well as researchers have a lot to learn. But when funding is available and structured in a way conducive for academics and community partners to come together, it can have a positive outcome.
And Dr. Barbara Segarra, Professor and Dean of the School of Health Professions at the University of Puerto Rico, led a session on patient advocates in research.
The patient advocate is that voice of a patient that can be translated to researchers, policies, and other areas. Patients should be participating in the whole cycle of the research to benefit the research and the outcome.
Experience the TS 2025 conference on our May show, episode number 133. In May of 2025, Dr. Jay Bhattacharya was appointed as the 18th director of the National Institutes of Health. And just 30 days later, he was on campus speaking at the Medical College of Wisconsin. For our June show, we shared Dr. Bhattacharya's presentation at MCW, what he calls his blueprint for the future of biomedical research.
It's very, very important that I start by saying that the NIH remains committed to supporting the biomedical infrastructure of this country. And it's in the medical schools and the universities of this country where the vast bulk of that work gets done.
Which is why he agreed to speak at MCW in the first place.
Because I wanted to convey that as a starting point of this discussion. And Wisconsin in particular is a state that's been very successful at garnering NIH money and has a long history of great accomplishments in biomedicine. And I would love to have that continue into the future. In fact, I know it will.
As part of his blueprint for the future, Dr. Bhattacharya told us,
we have to encourage free speech in our scientific community. My goal is to foster a culture where scientists can express disagreement respectfully. I want respectful disagreement and reasoning. I might end up agreeing with you. The key way to always be right, when you're wrong, just change your mind.
Hear the new NIH director's blueprint for the future of biomedical research on our June show, episode number 134. When we think of treatments for a disease or a disorder, we usually think of drugs or devices to provide better outcomes. However, there's increasing evidence of the healing power of music for some neurological and mental health disorders. In July, we discovered some amazing therapies that are utilizing the power of music as medicine. We heard from Dr. Alexander Pantelyat, Associate Professor of Neurology and co-founder and director of the Center for Music and Medicine at Johns Hopkins University.
Our vision can be summed up with a dual motto of music as medicine, medicine for musicians. In relation to that, our dual mission is to make music and rhythm an integral part of treating and healing various illnesses. And the other aspect of the mission is to help create a new subspecialty of performing arts medicine for musicians.
What specific diseases does the center focus on in utilizing music as medicine?
I'm a movement disorders neurologist. I have training that allows me to evaluate and treat patients with a wide range of mostly neurodegenerative conditions like Parkinson's disease and Alzheimer's disease. And that's really, for the most part, been the focus.
Then we learned about Music Success, a nonprofit organization in our community using the power of music to provide therapy for military veterans and first responders with post-traumatic stress and other mental health conditions. Patrick Nettesheim is the founder of Music Success.
We create music-inspired communities that support humanity. With this in mind, we focus on military vets, firefighters, law enforcement, and medical professionals.
And Music Success has already achieved a level of success.
People are saying, this has saved my life. Now I'm telling them, you saved your life. If we inspired that, well, thank you.
Discover music as medicine on our July show, episode number 135. In August, our show focused on a couple of breakthroughs in cancer research playing a pivotal role in advancing treatments and therapies to fight and hopefully beat the disease. We heard from Dr. Salim Farhat, Professor, Department of Radiation Oncology at the Medical College of Wisconsin, and Director of the Pediatric Radiation Oncology Program at Children's Wisconsin, who shared his expert insights on proton therapy.
Radiation therapy that we know of for a long time has been pretty much with photons, that's PHOTON, generated electrically by a linear accelerator machine.
This type of photon therapy has traditionally been a form of radiation treatment for cancers.
Traditionally in the sense that it's available wherever you would go for radiation therapy, and that involves photon beams that would travel through tissues and exit out.
But today, there's another emerging cancer treatment therapy, proton therapy.
Protons are charged particles. That's how it differs from photon therapy. When you expose tissues to photon therapy, it will travel and it will exit through the other side.
With proton therapy, the treatment can be targeted to a specific area.
With the proton beam, that's a charged particle, and it will travel to a certain depth, and it would literally stop. So if you know how deep you want to treat, you could actually not expose any tissues further away from what you're treating.
Then we heard from Dr. Razel Kurzrock, founder of the Rare Cancer and Precision Medicine Clinic at the MCW Cancer Center. Dr. Kurzrock shared insights about rare cancer research and the shift to precision medicine.
Precision medicine has had an enormous impact on cancer research and treatment. It has basically begun to transform the whole model for treating cancer.
Which means research scientists can now identify
the specific failure in an individual patient and how to give drugs that counteract that failure in order for the patient to respond.
Advancements in cancer research, treatments, and therapies on our August show, episode number 136. Acidic and non-acidic reflux disorders of the upper gastrointestinal, or GI tract, cause discomfort and even damage for millions of Americans. In September, our show focused on two common reflux conditions. We heard expert insights from Dr. Nikki Johnston, professor, Department of Otolaryngology and Communication Sciences, and leads the Pepsin and Reflux Lab at the Medical College of Wisconsin. Dr. Johnston shared how common reflux conditions like laryngopharyngeal reflux, or LPR, and gastroesophageal reflux disease, or GERD, can be.
Reflux conditions are very common. Gastroesophageal reflux disease, or GERD, affects about 1 in 5 people in the United States, and that's over 60 million individuals.
And as for laryngopharyngeal reflux, or LPR,
it's a bit harder to pin down, but estimates suggest it may affect around 10% of the population, with some reports actually suggesting over 80 million individuals have LPR in the U.S.
Of the two reflux conditions, is one more debilitating than the other, or are they equally serious?
So they're both serious in different ways. GERD has more visible, measurable symptoms and is often easier to diagnose. LPR is a bit more elusive, and since it lacks heartburn, many patients are misdiagnosed with either allergies, asthma, or even anxiety. And we hear this over and over. Patients will say, I saw 5 doctors and still didn't get any answers. And so that's what drives my research.
Then we met Sam, a singer-songwriter based in London, who suffers from LPR.
I would suffer from really weird sore throats, like not usual, and it would look quite red and inflamed. And there's a lot of throat clearing, a lot of tightness and discomfort.
Get the lowdown on upper GI reflux conditions on our September show, episode number 137. In medical research, having good data is invaluable toward gaining better information. And gaining better information from data is the key to increasing medical knowledge. In October, we explored how data scientists play an essential role in advancing medical knowledge through research and discovery. We heard expert insights from Dr. William Hogan, professor and Mary T. and Ted D. Kellner Chair of Data Science, director of the Data Science Institute, and Associate Director for Data Science in the Mellows Center for Genomic and Precision Medicine at the Medical College of Wisconsin. Dr. Hogan shared the overarching mission of the Data Science Institute.
Our mission is to meet the data science needs of our researchers and our healthcare partners. So in that sense, data science is a science in service of science, but it's also in the service of clinical healthcare practice. But, our researchers need data scientists as collaborators to do things like genomics data analysis, to do imaging data analysis.
Which means that
increasingly, as we get newer and more innovative types of data, as we get larger data sets, as we get more sophisticated and nuanced data sets, data science is increasingly relevant to the research mission. And then, of course, all these types of data move from the research side to the healthcare practice side. And so they need data science help managing those data and working with those data. The criticality of data science has grown. The volume of data has grown. The types of data have grown.
Get all the facts on the Data Science Institute, Converting Data into Knowledge, on our October show, episode number 138. Glaucoma is an eye disease that can gradually deteriorate our eyesight up to and including a complete loss of vision. In November, we set our sights on improving outcomes for glaucoma. Dr. Sylvia Lara Moses, Assistant Professor, Department of Ophthalmology and Visual Sciences in the Eye Institute at Frederick and the Medical College of Wisconsin.
Glaucoma is a chronic eye condition that damages the optic nerve, the nerve that connects your eye to your brain and allows to see.
Our eyes contain an essential fluid known as aqueous humor.
Aqueous humor have all the nutrients inside the eye. It's like the tears, but it's inside the eye. It's a natural fluid that nurses all the structures inside the eye.
But when someone has glaucoma,
the problem starts when the fluid doesn't drain out properly. When drainage slows down or get partially blocked, the fluid builds up and the pressure inside the eye rises, kind of like a sink with a slow drain. And over time, that higher pressure can push up the optic nerve and cause damage,
making it critical to monitor optic nerve pressure. Dr. Sahar Bedrood is an expert in complex and advanced glaucoma treatments who told us,
what has really shifted in the mindset of glaucoma specialists lately because of technologies that have come on board is you diagnose earlier, you treat earlier, and by doing so, the thought is you reduce the chance of meaningful vision loss.
One technology in development to improve glaucoma outcomes are smart contact lenses.
A soft contact lens that has a mechanism that measures the pressure of the eye while it's in there.
Which is groundbreaking.
Because the only time we know the true pressure of the patient's eye is when they come to the clinic. And that may be every 3 months, every 6 months, or even once a year. And that simply is not enough to understand how the eye is behaving and how the pressure is when we're not monitoring it.
Discover glaucoma, setting sights on improving outcomes, on our November show, episode number 139. That completes another year of shows, highlighted on this special 2025 Year in Review edition of CTSI Discovery Radio. Thanks to all of our guests from all of our shows throughout the past year. And above all, special thanks to you for supporting CTSI Discovery Radio this year and in the year to come. Join us in 2026 as we bring you even more shows exploring the latest in translational science and research. Don't miss a single show. All through 2026, catch CTSI Discovery Radio on the third Friday of every month. And be sure to make an appointment on your 2026 calendar so you can join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you a warm, memorable holiday season. And let's toast to a happier, healthier new year. For more information about research or to listen to the podcast of any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Julie Freed.